Right. If you work with children then, or not, have you have any kind of experience in that field? What is exceptional in that, if you think?
Well, I haven't worked so much with children. There are different reasons for that, but I think in some way it's easier to work with children. In other ways it's more difficult. One way is that children, they are always honest. At least if they are young. But grown-up people, you can not always trust them. If, for example, if I ask them, is this painful when I move them?
They say no.
They say no, because they think, oh, I shouldn't be weak, and that is when to be able to. And for me as a practitioner, my job is to be so sensitive, so I can see through what they are saying. I can feel it, and often I don't put the question before I can feel that they are in pain, and then I put the question, because that gives me an answer how they are sort of coping with pain.
I see.
But the child, with a 6-month child, they are not lying.
They just cry.
They cry, or they do something else. They take their hand away or something like that. And that, in some way, it makes it easier. In other ways, it makes it more difficult.
Why difficult?
Maybe not difficult. I'm not sure. maybe it makes it easier.
I see. Yeah.
Maybe I learned something now.
Some people say that there's a responsibility with children. Is higher.
I think maybe the most difficult part is when you work with small children. You have to realize you also work with the family. You work with the parents too. Because if they are not involved, then it's a lifetime work for you.
Huge question then. How do you cope? How do you manage the expectations of family, of others around the patient?
Well, I don't know. Now I think that's... as I said, I haven't worked with small children very much, so I haven't been in that situation so much. But sometimes it could be similar if you have an older person and you have their husband or man, it could be the same. And I think, for me, you have to be honest. Don't give them false hope. Don't give them expectation that you can't fulfill. You have to be honest. Say, maybe you know, maybe you don't know, but we can always try.
Still, people are looking for some kind of comfort.
Of course, you have to give them hope, but not unrealistic. But you give them hope by, for example, doing an FI, and they see the result.
I see.
And that gives them hope. So you don't give them hope by talking. You give them hope by acting, and give them something. Give them the sense that it feels different, and also to give them. Yesterday I gave a lesson to a young girl with a scoliosis, not very big, but my goal for that was to make her feel her scoliosis, and also to make her feel that if she do certain movements, the scoliosis can change. It's not anything permanent. So I hope I gave her the feeling that she is in charge.
So
in some way.
Well, again, the question of responsibility comes to that. So giving this kind of hope, you give people an opportunity to be responsible for their hope.
I think so. Of course, and that you can't do with a baby or a small child.
It's important.
Then you have to give the parents this hope, or sort of, so that they can feel, I can do something also.
And how can they be involved in other ways then? Do you make them? Do you teach them somehow to continue the lessons then after?
Again, I haven't been working so much with that, but you hear
not maybe exactly the children, maybe some relatives or.
Well, again, I can go back to the lesson I gave the scoliotic girl yesterday. We did a break about halfway into the lesson. And her mother was with her, so I had her mother lying on the table. And I showed her how she could sense things. So that was the first step.
I see.
And then maybe next time, if I would meet her again, maybe I would have them to do some awareness to movement together, so they can have a similar experience. And in the longer run, I would probably have them, when I would do some movements with the girl lying on the table, I would probably have her mom do the same thing, and the daughter giving feedback to her mom. So in a way, my goal would be to make this young girl the expert of her own scoliosis, and then she can use her mother to help her. She can give her mother advice. If you lift this shoulder in a certain way, that will help me to relax and help me to sense my back in a different way. But that takes time.
Yeah, but this is revolutionary, to be honest.
You think?
Yes, I think so. Including people in active way, giving them responsibilities.
Yeah.
I think that's new.
Actually, it has taken me some years to realize that is maybe the thing I have to work more with, to include the person, and also it's not about me doing things. It's about me helping them to find their own way.
Empowering.
Empowering them, yes.
Okay, I think that's the good alternative expression for the revolution I just mentioned about.
Yeah, empowering is a very good word.
Well, okay.